So cheek reduction surgery, or what we call Malarplasty, is designed for patients who have prominence of their cheek. So although we do associate prominent cheek with beauty, sometimes if it's too large, or especially if it's too wide, then patients kind of view that as a face that's maybe too large. One of the things to sort of kind of balance though is if we actually reduce the cheek prominence, especially for people who are maybe a little bit older, then sometimes the cheek can actually drop a little bit, which is not the result that we actually want. So it's very important to make sure that the patient is really an ideal candidate for cheek reduction. Nevertheless, the cheek reduction really makes an impactful appearance to a patient if they believe that maybe their cheek feature is too big. The way that we actually perform this surgery is we do what's known as an osteotomy, which means we actually break the bone itself. So the cheek composes of what we call an arch, which is this region on the side, along with the body, which is this component of the cheek. And what we do is that we do break the bone in two places, one on the side and the one more in the front. And once we actually break that bone, we can actually push the entire composite in so that we're reducing both the width of the cheek as well as the prominence of the cheek. And once we actually have it in place that we like, then we actually use a titanium plate and screws to stabilize the new position of that malar piece. So this is the way that we actually perform our malar reduction. And it's really an elegant way of addressing real problems for some patients. The way that we actually perform this surgery though is utilizing small incisions in three places. One in the temple region, one in the sideburn area, and inside the mouth. And through these incisions, we perform those breaks in the bone and reducing them and stabilizing them. The recovery time for a procedure like this is on the average 2 to 3 weeks. That's when about 80% of the swelling goes down, so that it's really not that obvious.